Hello, SJ here from the Rehab Hub in Glasgow. So I'm jumping on to talk about options for Verruca. Question we get every single day in clinic, phone calls, emails from you all. How can we help you with Verruca? So if you have got a Verruca, the first thing we want you to do is book an appointment. Put the link to book an appointment underneath this video. No matter where you're watching, there'll be a link there, and that will be the appropriate link that will help you get the help that you need and a diagnosis if it is an actual Verruca. From there, we'll usually treat on the day. We'll go through the different options, and in this video, we'll go through those options. But we'll give you an option of what your options are, and we'll get a management plan of that Verruca under place. Now, it doesn't matter whether you've been trying to get rid of your Verruca for many, many years. Many people have that. We're very, very used to that. We have a very, very good reputation. Just go and check us on in Google reviews, and there's various different pictures that our patients, really happy patients, have put up where we've managed to resolve very, very stubborn Verrucas effectively. In clinic here, we have two options for Verrucas. I'm going to go through these with you. The options are dependent on your presentation, your medical history, and your requirements, really, how you want us to manage this. It's up to you. So the first line usually would be where we're putting a solution on it. And what we do with that, you'll usually need minimum of 3, maximum of 6 appointments. And that you pay for each appointment every time you come in. So your first appointment when you come in to see us, you pay usually £65 for that, and then any subsequent appointments after that are £55, and that includes your treatment within that. And for the conservative treatment, most people need 3 appointments, and you would get everything you need between those appointments all given to you away in a pack, and you would usually see us every 2 weeks for that. So we'd usually have your Verruca resolved in that case, usually a minimum of 6 weeks and a maximum of 12 weeks, usually for the majority of them that we see. Now, if we've got more stubborn ones, or we've got ones that have been there for years, or we've got loads of them, big clusters, it does depend. But again, we get some amazing results. So a maximum of 6 treatments and a minimum of 3 with that conservative option. Now, in terms of our other option, we would do Faulkner's needling. So Faulkner's needling, what we're essentially doing with that is we are pushing the Verruca virus as the human papilloma virus. We're pushing that virus and disrupting that tissue and pushing the virus into your bloodstream to effectively try and stimulate an immune response. Now, the first option that I spoke about, we are not primarily working with the immune system, although we will disrupt the tissue, which will be working with the immune system, but we're also primarily targeting with the first option, we're primarily targeting the DNA of the virus itself. So even if you're immunosuppressed, which many of our patients are, we get great success with that option. The second option, which is Verruca needling, is totally looking to work with the body's immune system. So if you're immunosuppressed, that sort of option wouldn't be something that we would recommend. It's less likely to work. If you're not immunosuppressed, it might be a good option for you. With that, we are damaging the tissue. We numb your foot. That will usually require that you get an injection into your ankle, and that's so that we can knock out the tibial nerve, which is the nerve that innervates, that basically supplies the plantar aspect of your foot. So we'll usually give you an injection there, and that will numb your foot, and then we can then carry out the Faulkner's needling, and it usually only needs to be done once. So it's quite a good solution for those of you that are maybe travelling quite far to us, so you're only really needing to see us that one time. Or it might be a solution for those of you that are really strapped for time. That whole procedure costs £280. So you're just coming the once, you would get all your little dressings and plasters and stuff that you would need to put onto the area that we've created that wound. And even if you had clusters, it doesn't mean that you would have wounds all over your feet. We would usually go to the biggest cluster and damage that area. And by doing that, the theory is there that would invoke that immune response and clear them all up. So that is your 2 options here. So we either attack it from the DNA side, or we attack it from the immune system side. That is how we tackle Verrucas. Now, in terms of how soon we can see you, what type of patients we get, is it sore? Let's go through some of that. So in terms of treatments, for most of our Verruca treatments, we wouldn't see patients under the age of 6. That just depends on circumstances, but depending on what we were going to do, I certainly wouldn't be doing Verruca needling on a very young patient. That's just maybe not ethical. And for some of the different options that we have here in clinic, we are the manufacturer's guidelines are they can't be used on patients under the age of 6. But that's not to say we don't have other solutions for them. So if you've got a young one who's got a Verruca, we still can treat them. It just does limit the types of options that would be available to them, but we can absolutely still help. In terms of, is it sore? Now, Verrucas generally aren't sore. And I say generally because for some patients they are. They can get very big and you get a lot of macerated tissue growing on top, and especially if you're using over-the-counter stuff that you've maybe picked up from your local pharmacist, we can end up getting this bulk of tissue and it just all goes, let's just say, yuck. And that needs to be removed. So that's our job as podiatrists, where we will remove that with a scalpel and under hygienic and sterile conditions. So please don't get your kitchen knife out and do that. So we will remove that tissue, and if we need to use local anaesthetic, we can absolutely do that to numb the area if that's required. And for some patients that is required because it's got to the point where it's so big that it's become something that's really damaged the other tissue around the Verruca, that they can be in a wee bit of pain. And we've had a few youngsters, and I say youngsters, particularly around about the age of 11, 12, where that's been the case. One particular case that springs to mind is a 12-year-old little girl who was immunosuppressed, and her Verruca was on her heel, and she'd used all sorts of stuff. Her parents had used all sorts of over-the-counter medications on it. The tissue was really quite overgrown and macerated. It looked like a big cauliflower, to be honest, on her heel. And it meant that all the associated tissue around it was really raging and annoyed and red. So she was limping and couldn't do PE at school and various different things like that. So we had to numb that up for her, give her a local anaesthetic and get it all removed, get all that tissue off. And that particular immunosuppressed patient, we only needed 4 treatments and we had it all cleared for her. And it was pretty bad. Her dad was absolutely delighted with the results from that. So we can absolutely help with Verrucas if you're struggling with them. So please, just the initial thing to do would be to book that initial appointment, because what we have to do is look at you individually. We get loads of you DMing us and sending us emails asking us for advice for what they think is a Verruca. And ethically, I mean, professionally, we can't really give you advice like that because we've not looked at it. We don't know what we're dealing with. We don't know your details. We know nothing about you. We don't know your medical history. So it wouldn't be responsible. It wouldn't be professional of us to give you things to do. So even if you're not wanting to do a particular treatment with us, if you're maybe just wanting reassurance of what it is and maybe guidance on how best to get rid of it, then that's you would just book an appointment for that as well. But rest assured that we've got solutions there, even if you are at your wit's end with them. Loads of people that come have been and they have tried everything beforehand and they have no confidence that it's going to work. And that's fair enough. It pleases us so much when they're proven wrong, which is great. That's exactly what we want. We want to have happy patients that don't think it's going to work, and then we get a solution for them. So that is Verrucas. So if you're struggling with a Verruca, if you need some help, advice, guidance, then just book via the link below. Oh, there's somebody messages just now. I bet it's about Verrucas. So please just don't hesitate to reach out and get advice, book in for an appointment. We are over in Kinning Park in the south side of Glasgow. Super, super handy. No matter where you're coming from, we are right next to the M74, the M77 and the M8. Quite literally a minute's drive away from all of those motorways, and parking for us is on street, and it's completely free and dead easy to park. So you can park right outside. It's easy to get to. And if you don't drive, there's tons of buses that run up Paisley Road West, and you've also got 2 tube stations that are under a 7-minute walk, actually equidistant, whether you use Shield Road or the Kinning Park. We're kind of in the middle of both of them. If you remember where the old News of the World headquarters were, we are right next to that. We're next to Rise, the big trampolining centre, Wonder World, where all the kids go. So if you go to these places, we're right next to all of that. We're closer to Paisley Road West End. Underneath us, so we are up on the first floor, and underneath us is a company called Hydropool Scotland. They sell big hot tubs. So we're just above there. And inside our facility in the south side of Glasgow, we've got the clinic, which I'm in just now. And then we've also got our rehabilitation and Pilates studio in here as well. So it's a big premises. You can't really miss us. We're called the Rehab Hub, but handy to get to no matter whether you're coming from the south of the city, the north, the west. It's dead handy. And even people coming from like Motherwell, Hamilton, Wishaw, out that way as well, and even as far as Edinburgh, coming through to see us just for various different things that they wanted help with. So book in. I've put the link with this video. If you need help with a Verruca, please, just even if you're just wanting a bit of advice, it's worth just getting that reassurance that what you're doing is the right thing, making sure that it is a Verruca as well, and there isn't some bite or foreign body or some infection or some other growth going on. So getting us to look at it, that's our job. We're podiatrists, we are lower limb experts, that is what we do. We look at these day in, day out, and it means that we can really look at that tissue, get a proper case history, and get the best course of action for you. And sometimes that is just reassurance that it isn't anything else more sinister as well. If you've any questions, pop us a DM. I've already got one there that I need to respond to. So thanks for watching, and we'll maybe see you in clinic really soon.